Akimoto here. Doc, good morning, Doc.
Good morning, Chris. How are you?
Good. So we haven't spoke to you.
Couple days.
Yeah, it's been a few days. Can you just tell us?
No, honestly, it was. I think it was yesterday, buddy. You guys
Oh.
have just been living this nonstop. No, I think I just spoke to you like 12 hours ago.
Oh.
You guys have been living this, and we need to applaud your whole team because it's an incredible amount of information and coverage, and I'm pretty sure it's starting to feel overwhelming. But no, I just spoke to you like 12 hours ago.
Oh, that was you.
Sorry.
Okay.
Just kidding.
All right.
I'm
You know, all you doctors sound the same. So, Dr. Vince, what's going on? Just give us your situation.
Well, as you know, there's more cases even in the last 24 hours, and I just got off the phone with Dr. Wen. He was running our urgent care clinic last night, so throughout the whole day we saw over 150 patients through our system. We tested many patients, and at least one of the patients that I swabbed is almost a guarantee positive, and he says he thinks there's at least 3 others. So our clinic is seeing a tremendous amount of people who either have traveled within the last 2 or 3 weeks where they may have been exposed, or they've been encountering people that may have been exposed or have been found to be positive, and so they're at risk. And so they're coming to our clinic for testing. And so American Medical Center is now the epicenter of testing on Guam. But we are very frustrated with public health. The message today is that the public health, Guam public health has failed. This call is a vote of no confidence in the physicians who are mismanaging the Guam public health system. They have continuously blocked our ability to test rapidly. They've delayed the results coming back so that we can tell patients whether they're negative or positive. I don't have to ask their permission to do an HIV test, a diabetes test, or a syphilis test, and these or when I run tests for a heart attack or a stroke. So they're defeating our ability to treat this disease and contain it. And I'm calling for the governor to remove Dr. Maglonia and Dr. Poblitsky immediately. We have many other doctors on Guam who can do a better job, and they need to leave because they've hurt our island. We have the greatest number of people testing positive per testing. I think it's something like 16 tests yesterday. 4 were run and 4 were positive. That's the highest in the nation. We lead the United States now in, I guess, what you would call penetrance or maybe accuracy. We don't apparently waste a lot of tests here. We have to make sure you're absolutely likely to be positive before we'll run a test.
And that's going to lead to a higher percentage, right, Doc?
That means people are spreading the disease because we know a lot of people are asymptomatic. And the thing is, when people tell you that they might have been exposed, you might want to believe them if they have a cough and a fever. You know, why are we getting in these arguments? People are afraid. They're panicking. They're coming into our clinic to ask to be tested. I'm going to test them. And we're finding now that we have one of the largest penetrants of positive tests in the nation. And we believe that most of these people are going to survive. They're going to do just fine, particularly if they stay outside, get some exercise, and get a lot of rest. You know, if you're going to be in lockdown or whatever we're calling it today, it's not a miserable situation if you're going to survive this epidemic, and we're going to kill it. We're going to keep the virus from finding new hosts. And it's going to die out because Guam is good.
Doc, I got to ask you because it kind of seems, and I've heard this from other doctors, people want to get tested, they can't get tested. Is it because we don't have enough tests?
No, absolutely not, because apparently we still have about 75 left. You know, after receiving the test last week, we still have about 75 left, despite the fact that we just ran 16 tests yesterday. I mean, we're running 10 to 16 tests a day. Apparently there's quite a number of people quarantined in hotels around the island. If we would test those people, we'd find out whether they were positive or negative. Sorry if I'm kind of racing. I'm going to slow it down. This is not panic. This is anger. I'm not afraid. I'm very mad that our public health system, particularly Dr. Maglonia and Dr. Ann Poblitsky, have not worked with this community of physicians who are on the front lines. They've defeated us. We don't need them, and there are other doctors that are willing to step up and need to step up. I'm calling on Dr. Mike Cruz as the czar of COVID-19 test. This whole effort. to replace these people, and we will move on functionally because we have people that know what to do. The people in the lab know how to do this, and it's amazing what Mr. Malari was able to do in such a short period of time. He is one of the heroes of Guam. I bet that guy hasn't slept much. In the last 7 days, he's run 81 tests, and I don't quite know. 16 of them are positive. So he's run 81 tests, 16 of them are positive. That's probably a world record. We are leading the United States and perhaps the world on this day in terms of the greatest number of positive tests per person tested. And it's all statistics. It's all science. Who cares? Coronavirus is here. It's probably not going to kill you, but if we have it spreading, we need to know where it is. That's what public health is supposed to do. And, besides that unpleasant bit of advice that we're giving to the government of Guam, which is to remove Dr. Jana Maglonia and Dr. Aaron Plavitsky and replace them with competent people, we will persevere. We need to move on. This is just like a football game or a basketball game. Sometimes you have to substitute some people. It's unfortunate, but that's what we're doing now. It doesn't mean that this fight is over or that we're going to lose. Yesterday, we took care of 150 people in the American Medical Center system, and they did just fine. The American Medical Center is open today. We will continue to see people. The emergency room is open today. Both hospitals are fully functional. We're going to be just fine.
Doc, there was some talk this week about those on the front lines, healthcare professionals, doctors, nurses, possibly being exposed or quarantined. Can you tell us anything at all about that? We weren't able to get anything.
We're all being exposed, Chris. I mean, when you go to Kmart, you're exposed. When you go to work, I mean, all these media folks that are walking up to people, they're exposed. You're gonna evolve, or you're gonna die. And my money's on you evolving. You're gonna adapt. You're gonna kill this virus. Your immune system's gonna do just fine. There are some people, unfortunately, that don't stand a chance, but hopefully you're not one of them. So I'm really glad you quit smoking, by the way.
Thanks, Doc.
I did want to ask a question just for clarification. When you say that you took tests, can you explain what you mean by that, and then how it goes to public health?
So we are donning that full protective gear that you see on TV. I mean, it looks like what is that? Contagion. The patients get to see me then looking like a monster or some sort of astronaut, and it literally is an out-of-world experience because I can barely see them because there's steam fogging up my mask. But the test is really simple. It's just a really small little swab, almost like a Q-tip, but very, very expensive. I think it's like $1,000 a pop.
Wow.
And we collect the mucus on both nostrils. It's not pleasant. Mr. Trump had it done to himself, and he complained about it. But
yeah, it's a little sharp at the top.
No, it's not. Don't be a baby. It's really soft. And that's the thing. The guys always think they're going to die, but the women, it's nothing. I think it's more tough to pick out nose hair than this. And then we do it. It takes very little time. It takes more time to take off all the equipment. And then so every time we do it, it's like surgery because we have to we gown up sterilely, and then we have to de-gown very carefully because stuff splatters on us, and we're not taking any chances because I expect to go home to my kids, right? So I'm me, my nurses, my whole staff. Every day we're exposed to potentially a lot of coronavirus. And so far, I don't want to jinx myself, but I'm doing just fine. And there have been other doctors and nurses that have been exposed, and some of them have gotten very sick, but they've recovered. And so we plan to do the same. And supposedly, I will be immune, and I will never need to worry about coronavirus for the rest of my life if my immune system evolves, and I fully expect it to. So that's why I'm actually talking to you from the beach here in East Agana, looking at a Lupang Island, and it's actually a beautiful day. And I'm taking my own advice. I'm coming down here to kill coronavirus, and guess what? There is no coronavirus on the beach here on Guam. So,
well, thanks, Doc.
So you take the swab. I can't even say it.
Schwab.
So you take the swab, and then you call public health, and they come pick it up, and then they decide which one.
They don't come. No, they don't come and pick it up. One time or twice, the lab director came and picked it up, and I said, "What are you doing here? You're supposed to be running the test.
Right.
You're supposed to be running the lab. There's only 3 people in the public health lab, and I'm going to tell you, all of them are saints. All of them have been abused by multiple people on the phone and in person. I mean, they're just doing their job. So please quit yelling at them. Those folks in the emergency room, they're doing their job. Let's not be, cute about this. It's their bosses. Their bosses tried their best, and they failed. We are now the most infected island on the planet. Public health has failed. The leadership failed. They'll be replaced, hopefully, by the end of this show, and we'll move on because, there's no victory in somebody else's failure. We need to get through this, and we're going to get through this, and hopefully nobody dies. We don't need to talk about death. We'll talk about life, and we're going to evolve. We're going to defeat this virus.
Doc, thank you so much for your 2 cents there. Really appreciate it. And thank you.
That was more like a $500.
Yeah, it was. I could probably buy some test kits with that.
Have a great day.
You too, Doc. Dr. Vince Akimoto. Love him. Never one to mince words at all. How alarmed are you by the things that he's saying, calling for removal of Dr. Maglotnia and I believe the territorial epidemiologist, Dr. Amplebutski?
Are you asking if I'm alarmed?
Yeah, are you? Or is that something that, we have a doctor out here who's...
at this, I'm more shocked that we're not getting basic information, so that's where I'm at.
Right, that's what you're... Okay. 816-637-0094, our number. Facebook comments, we got that, and then I think we're going to run out the governor's special address here. The order goes into effect in about 3 hours and 45 minutes.
Right, and it'll be in effect until March 30th. All businesses that aren't deemed essential will close down. You will still have your takeout service, so don't worry about that. Laundromats, gas stations, grocery stores will still remain open. But the idea here is for you to stay home.
Yeah, and that's kind of the main point. And I feel like when people hear that there's all these exceptions, they think in their mind like, oh, okay, well, we're going to go to the store. We don't even need groceries. Let's just go walk around. But the idea and the intent of this order coming out is that we need you guys to stay home so that public health can run around and backtrack and trace, investigate, and do all the things that they need to do. We know they're overwhelmed. We know they're understaffed, so they definitely need a lot of room to work with if we're going to, turn the corner on this COVID-19, which I think we're just getting started.
Yeah.